What are the signs and symptoms of depression in men? Men and women alike may experience depression at some point in their lives. Depression can be a serious condition that affects how a person thinks, feels, and acts. In this age of heightened gender awareness and respect, it's important to note that men may experience depression more than women do, though there is a prevailing social stigma surrounding the topic. This hypothesis stems from the fact that it might be harder for men to notice or tell others about feeling depressed due to an abundance of social factors than biological ones, which make them incorrectly self-diagnose. When you're struggling with depression, it can be tremendously difficult to see what's right in front of you. You know that something is wrong, and yet the symptoms are so well hidden that they elude your awareness. If you think that you or someone you love could benefit from this, then watch this video now to learn more, but make sure you stick around because we're going to give you some good information on how to better spot the signs and symptoms of male depression when they happen. Men with depression may first notice its physical effects. While depression is thought of as a mental health disorder, it can also manifest in the body. Many men are more likely to visit their doctors for physical issues than for emotional issues. A number of physical symptoms accompany depression in men, including chest tightness, frequent stomach and digestive problems like diarrhea, low testosterone levels, pain, racing heart and heart palpitations, unintentional weight loss or gain. Men may experience mental symptoms of depression differently than women, and present signs of the condition differently, making it more difficult to detect. These symptoms include cognitive and behavioral changes that can affect thoughts and feelings. The most common mental symptoms of depression in men includes difficulty concentrating, memory problems, obsessive-compulsive thought patterns, racing thoughts and sleep issues such as insomnia or hypersomnia, moodiness and suicidal thoughts. When people think of depression, they tend to associate it with sadness. However, depression can also cause feelings of guilt, worthlessness, helplessness, and/or hopelessness. Symptoms of depression may include the following in addition to sadness: restlessness, sleep and appetite disturbances, irritability, agitation and aggression, anger outbursts at friends and family, a pessimistic attitude, withdrawal from social and occupational activities, loss of pleasure in daily life, and suicidal thoughts. Mental, physical and emotional symptoms of depression in men often result in behavior changes. Because men are often less willing to discuss their emotions, their behavioral symptoms are the easiest for others to detect. The behavioral symptoms of depression in men most commonly includes difficulty meeting work, family, and other personal responsibilities, drug misuse, excessive drinking, risky activities, such as driving recklessly or having unprotected sex, social isolation, and suicide attempts. While the scope of discussion around mental health seems to be expanding, there is still a stigma surrounding depression among men, who are socialized by society to hide their emotions. Though they may be suffering silently, men oftentimes compromise their emotional and physical well-being by conforming to restrictive social expectations. Many men do not seek help for their depression because they never recognize the signs. On the other hand, some men who do recognize the signs may struggle to discuss their experience because they fear the judgment of others. As a result, these men often work long hours or otherwise try to stay busy without addressing their depression. Untreated depression can lead to severe problems in a person's life, including suicide. For men with depression, talk therapy and medication help alleviate their symptoms and allow them to live their fullest possible lives. The treatment depends on the severity of symptoms, but a combination of talk therapy and medication is often effective. A healthcare professional can help create a personalized treatment plan that works best for you. If needed, your therapist may suggest complementary care, such as cognitive behavioral therapy, interpersonal therapy, problem-solving therapy, and psychodynamic therapy. You may also be prescribed medication. In general, antidepressant medications are often prescribed for people with more severe cases of depression. Antidepressants, such as paroxetine, Paxil, or sertraline, Zoloft, may be used. But these medications take several weeks to months or longer to begin making a noticeable difference in the way you feel. Do not expect to feel completely better right away. Mental health is a topic of discussion that has been gaining more popularity in recent years. In spite of recent strides, many men find it difficult to talk about their emotions in a society that upholds traditional views about men. By sharing knowledge about the symptoms of depression, we can help clear a pathway toward better, more inclusive mental health care. Talk therapy and medication are both effective treatments for depression, and when used together, become even more effective. Like, share and follow for more educative contents like this. Thank you.